Hey guys, I'm Dr. G from Beach Wellness MD. Really nice to see you and meet you all. So Whitney was nice enough to come on in and get a treatment of Emsculpt and share her story with her followers and fans. And I have to admit that she's super awesome. Positive attitude, giggly, amazing shape. So basically, Emsculpt is a non-invasive, FDA-cleared device that uses an electromagnetic pulse to cause the muscles to hypercontract. So it's a super physiological contraction, and this occurs 20,000 times in 30 minutes. So it's sort of like 20,000 crunches or 20,000 squats. And the recommended course of treatment is 4 treatments over 2 weeks. And then what happens over the next 4 weeks following the final treatment is that the muscle remodels and hypertrophies, and the fat shrinks or melts. So basically you get about a 15 to 20% increase in muscle in that area and a 15 to 20% reduction in fat. And it's really an ideal treatment for people that are healthy and fit and want to get that extra definition in their abs, want to get a non-surgical butt lift to even out the cellulite and get an increased round upward appearance in their buttocks. And so far we've had some very happy patients. I think it's important with all non-invasive treatments to keep in mind that the results are going to be moderate, right? It's not going to be as dramatic as a liposuction or a major surgery, but it also doesn't involve general anesthesia, doesn't include the cost, and is not as invasive. So I think that if you have the right patient and you apply the right treatment and you really discuss expectations, you're going to have very happy patients. And if we can help you achieve your goals, more than happy to. So just reach out with any questions and we'll do our very best to guide you in the right direction and get you the best results possible.
Hi, I'm Ron here at Beach Wellness MD, office of Dr. Golshan. Here with Whitney, a patient today who we're going to do Emsculpt with. This machine is great at burning fat and tightening and toning the abs, glutes, arms. We're going to start with Whitney's glutes today. So I'm going to have you take off your pants and lay face down, and then we'll get you strapped in and we'll go ahead and start.
Sounds good. So this is a really awesome way to just have a totally isolated glute workout versus having to work your whole lower body. Because for most of us, our thighs want to take over and be the dominant muscle when we're doing lower body stuff. So I think this is a really good way to, if you're not working out a lot, get a head start on your glutes by doing something like this, and then resuming regular workouts. So you've got that kind of baseline glute muscle tone.
So right now we're going through a phase of tapping, and the reason for that is the machine is designed specifically with this to help release the lactic acid from the muscle. So you can imagine we're doing the equivalent of 20,000 crunches or 20,000 sit-ups, 20,000 abdominal exercises. This portion of the procedure is designed to help release the lactic acid, so the muscles can have maximum contracting through that 30-minute period, as well as alleviate the pain the next day by releasing the lactic acid. So it might be a little sore, tomorrow, the next day, or certainly some awareness, but you wouldn't be as sore as if you did 20,000 sit-ups. And then when we get back into the good part where you hear the buzzing, that's the muscles contracting and squeezing those abs and tightening and toning them and burning the fat on top.
And then 4 sessions is kind of the recommended.
Yeah, 4 sessions per body part in approximately a 2-week period is for optimal initial results, and then it takes 4 to 6 weeks after that to get actually the full results.
And then how long is it supposed to last for after your last session?
Well, sort of maintenance is up to the person. So if they're a couch potato and they don't do anything, it's gonna drop off quicker. But if you are someone who exercises, getting blood flow to the area, you don't necessarily have to do 20,000 crunches to maintain it. But you just need to be a physically active person who's exercising, because you can maintain the result. I won't say easily because exercise is not easy, but easily if you are trying, you can maintain that result. And then we recommend a tune-up quarterly.
For those of you that don't know, I've had 2 C-sections. So they cut, through my ab muscles. They cut through the nerve I definitely have a hard time engaging my lower abs. They don't really have a lot of feeling. They're pretty numb. So since I've done the one treatment of this last week, my lower abs are noticeably more tight and feel as though they're, activated, and I definitely never got that before. So this is the first time in 10 years that I've really been able to feel my lower abs contract, which is so cool.